are the recovery rate and or the survival rate for each stage of breast cancer?
Actually, there are tables written down on all the statistics. But basically, some of these statistics are not really that useful. What is more important is probably to understand that in cancer like breast cancer, patients with early breast cancer tend to survive longer, tend to have less chances of recurrence as compared to a late stage cancer, as in most cancer types. And then, of course, the second thing that we're worried about is the chance of dying from the cancer. The chances of dying from cancer, of course, is related to more of those patients who have got late stage cancers and so on. So this way of trying to link the chances of recovery and so on to the stage, I think it would sometimes give the patient a little bit too much of a fixed figure to focus on that may sidetrack them. I would suggest that you don't have to worry too much about the chances of recovery and so on. I give you an example. Elderly patients who sometimes come for treatment of breast cancer, especially those who are above 85 and so on, they may have other related medical conditions like recent stroke, heart attack and so on. And if you're worried about recurrence of breast cancer or chances of dying from breast cancer, I think you have a little bit more to worry about than the cancer if you already have this other medical problems. So as I said, again, there are also other patients who come in and say that they choose not to have certain parts of the treatment, or they sometimes go through the treatment halfway and then they stop the treatment. By doing that, you are also affecting your previous, or rather the figures that if we were to give you like stage 1 and how many %, because once you stop this treatment, you're not actually going according to plan. So I don't find it useful to link this stage to survival and so on. But one thing we are confident of is that if you were to detect cancer early, you will have a very good chance of recovery.
Okay. Yeah, of course we know that if we can detect early, by screening and all that, that's the best way.
Yeah.
So what are the breast screenings available?
Now, the word screening here means that we want to check for something we hope is not there. And not only that, we are checking on people who don't have symptoms. If you already have symptoms and you come for a check, it's a check, but not screening. Right. And so, for example, if a lady were to come in and say she wants breast screening, two types of scans other than the doctor's examination are important, because most of the time, if there's something in the breast and it is related to cancer or maybe benign lesions, they either appear as a lump, maybe you cannot feel the lump, or they appear as white spots, which we call microcalcification. And so, with the ultrasound of the breast, the ultrasound is actually invented to look for lumps. And so with the ultrasound, which has got no X-ray, we can actually try to detect lumps, sometimes even very small ones. But if the patient happens to have cancer or a lump or a lesion or an illness that has got white spots, unfortunately the ultrasound won't see them very well. So we send the patient for a mammogram, and the mammogram will be able to see the white spots. So basically, if a lady were to come in for breast screening and we use these two modalities or scans to look for a problem, we actually are trying to look for either you have lumps or you have white spots or you have both. But that doesn't again mean that you have breast cancer. It's just a sign that we need to go further. But there's no strict rule as to the age to start breast screening, because we have seen cases of breast cancer as young as 17, 18 years old, and in the 20s and 30s, it can be quite many. But to start screening for an average lady, person, I think you should look around the age of 30, 35. But that doesn't mean that people below 30 or 35 won't get breast cancer. It all depends, especially if the lady has got a strong history of breast cancer in the family. And even some young ladies already started their life off with many benign lumps and happen to be removed, benign of course. And we know that people with benign lumps, they may have a chance of getting a bit of a risk of breast cancer. On the other hand, if we were to want to introduce mammogram to the lady, we usually will tell them to perform a mammogram within the breast screening, other than the ultrasound, around the age of 35 to 40, because anybody who's younger than 40, 35, within the breast tissue is so dense, and when you look at the mammogram, it's actually whitish in color. And the calcium spots that we're looking for, the calcium spots are very important. The calcium spots tell us there's a problem. Unfortunately, the calcium spots are also white. And so with these white spots within the white breast, it's not easy to differentiate. And so, of late, of course, in Adventist hospital, we do have this 3D tomosynthesis mammogram, which actually is an improved version where we are able to detect white spots even in younger patients, and probably detect white spots more accurately. But again, keep in mind that neither one of these actually diagnoses breast cancer. In the earlier question you asked me, the only way to diagnose breast cancer is actually to have the tissue taken out. So these two modalities in the breast screening actually just help us to look further into the problem.
I see. So, how does women can lower the chances of getting this breast cancer?
Basically, if I talk about myself, being a man, I too have a chance of. It's just because we all have breasts. So, there's no real way of actually lowering the chance other than the first few questions that we talk about, which is to try and avoid certain risk factors. But again, I highlighted just now there are some risk factors that cannot be avoided. But we must keep in mind that breast cancer doesn't appear suddenly out of nowhere within one day. See, most of the patients who come in and speak to us, when they were diagnosed to have breast cancer, they get a shock. Everybody will get a shock at the sudden news. But they will then say that, why aren't there any warning signs? The reason they say that is because in them, they think that the warning signs, according to their own opinion or whatever they've read, is like, oh, there must be pain. That's a warning sign. There must be a lump, maybe bleeding, whether the skin and the nipple may show itself to be retracted or dimple, or maybe the breast has got a change in shape. See, all these so-called warning signs actually don't appear until they are late. But actually there are warning signs. Unfortunately, the warning signs cannot be detected by the patient. The warning signs can be detected by breast screening. If you come and do a breast screen, and within the breast screen we find a small lump that you cannot feel, that is a warning sign. If we do a mammogram and find that you have white dots, microcalcifications that you again cannot feel, no pain, no bleeding, etc., that's also a warning sign. So it depends on who understands what warning sign means. And if from the layman who think that warning signs must be everything to do with pain and bleeding, that's not the case. So once you remove this lump or these microcalcifications and find that, wow, luckily it's not cancer, but you know what, if you had kept it there for a bit too long, it would have changed to cancer, then in a way you have lowered your chance of getting breast cancer. I think that would be the best thing to do.
So Dr. Chong, is there any message or advice that you would like to share with our audience?
Yeah, the one message that everybody must understand and remember is that, as you pointed out earlier, this cancer, breast cancer, is the commonest in the world. And we know that it's the commonest in the world for women. But because it's common, we have designed certain ways to try and find out if we can prevent it to turn, or rather prevent it to turn into something that's of a late stage. And what we need to tell you is that this is a type of cancer that can actually be treated successfully. Successfully means that you have the potential of full recovery, but that is only if you are detected early. And when you are detected early, the treatment may not even necessitate mastectomy, and we can even avoid chemotherapy. But the important issue here is that every human being wants to return to a normal lifestyle even after breast cancer treatment and go back to their family. And this is where it is possible if the cancer is actually detected early and treated appropriately. So, which brings us to understand that why breast screening is so important, because being a simple procedure like breast screening, we can actually use it to help defeat a fearful cancer like breast cancer. Now, I believe that a lot of people now has got access to the internet, and they will read a lot of information off the websites and so on. But I want to reassure you that however or whatever you read off the website, it is not the same as when you come face to face with the doctor or the staff who are involved with helping to do breast screening and advising prevention and so on. Because there you can actually ask the staff concerned or the doctor concerned a lot of questions, and the answers given to you will make you understand it better and help you to lose the fear of breast screening, and hopefully not be too frightened if an early cancer is detected. And I think that is the most important message to, and of course, I think the other most important message is take care of your health during these times of a pandemic, and I give you my best wishes.
Thank you so much, Dr. Chong, for your sharing today. So that's the end of today's session. So for more information on breast screening and breast cancer, please call 04 222 7451. Thank you for watching. Bye-bye.